A very warm good evening to one and all. Welcome back to the today's session. Today's our guest speaker name is Dr. Neeta Chavan ma'am from Bharati Vidyapeeth Homeopathy Medical College, Pune. We welcome you, ma'am. Coming on to the small introduction regarding the madam. Ma'am has did BHMS from Shivaji University and MD from BAMU University, Aurangabad. And ma'am has been working as a teaching professional since 2006. From 2006 to 2016, ma'am has been worked as an assistant professor, reader, HOD at Ahmednagar Homeopathy Medical College, Maharashtra. And after that, as a lecturer in Ahmedabad Homeopathy Medical College, Maharashtra. Now, currently, ma'am is working as assistant professor in forensic medicine and toxicology in Bharati Vidyapeeth, deemed to be University, Pune. Today's our topic by our speaker ma'am is guide your mind to take care of your body. We welcome you all. We welcome you the participants. Session is hand over to you ma'am. Thank you.
Yes, thank you. Welcome all. Good evening. Today's my topic is guide your mind to take care of your body. At present you are seeing the screen. You are able to see how it is disorganized. All the pictures are disorganized. And now, if you see this picture, though it is a stress and everything is there, everybody which was in the first year, it was a messy, now it is, though it is having the stress and all those things, but if it is arranged properly, we can see and we can think that, yes, we can take some output from that, we can find out some root, or we can get relief from our stress, and which are the body sufferings are we are having, we can come out of it. So now, first of all, I will like to say, everybody is knowing that there are 7 layers of germination by Dr. Vijayakar. I hope so. Everybody is knowing that is from the embryology. We have seen, we have studied the embryology. We are knowing all the germinal layers and the presentation of it, that how or which are the systems or the organs are developed from that. So when it is the ectoderm, that is the skin, endoderm, the organs developing from that. The same way, when we get any disease, first of all, it gets expressed on our outer layer, that is of the ectoderm, that is the skin. But when it is gets suppressed by any means, it travels inside and it reaches to the deeper and deeper layers. And so accordingly, as per the sensitivity of that person, he suffers or his systems and organs get affected and he shows the symptoms. Now we will see that the mind, this is not only the mind, but mind, body, food, everything is correlated. What is our mind? What is our habits? Then the body, what we eat, then our workplace or our family members, the relation at our workplace, in our family, even in the society, and the food which we eat, it also affects our overall mind and the physics. So every day we are going for some stress. Different types of stress which undergoes or which we face. So usually the stress is our built-in response to danger as we choose between the either fighting, fleeing, or the freezing. Danger may be a real or imaginary. It may be immediate or farther away. Our body don't know the difference. Everybody goes under the stress somehow, sometime in our life. So there are different types of stress. So either it is an acute stress, that means it is the temporary period, episodic acute stress, chronic stress, emotional stress, or the battling burnout. Acute stress, this may appear for a very short time and subside when the stress eases. When we get that emotional distress, either it may get expressed either by the anger or irritability, that is a very temporary stage. Anxiety, depression, sadness. So these types of stress we get when, especially the students, when they go for the examination, either for the orals mainly, when the questions are asked and they are, even though they are knowing the answers, because of some stress or the fear, they are not able to answer and they get, yes, I was knowing, but why I didn't answer this? So that type of self-irritability, anger, or while facing the examination, they may feel the anxiety or the depression. But once the exam get over, then after some time, they will relax. But in some persons, it may be not only to the exams for the students. I just given the example for the students' examination. It may be at their workplace, it may be at a home, any situation. The person gets muscular distress or the physical sufferings because of the tensions. He may get the headache, migraine, sometimes back pain, neck pain, or the various tendons, ligament problems, or the cramps. For the stomach, they get some gut problems or the bowel problems like the epigastric pains, heartburn, acidity. Sometimes if some persons feel flatulence, some may get the diarrhea or constipation. We are having the various remedies also. When we say that because of the stress, the person gets diarrhea and he needs some medications. Then the next it is the transient hyperarousal. So when the person goes under that acute stress, when he suffers for that acute stress, in some persons they get elevated blood pressure. That is also a transient period for the some time only. Then they may get the rapid heartbeat, palpitations, pulse is increased. Then because of that fear, they get the sweaty palms. So we are having such remedies for that. Then we are having the Argentine remedies. We are having the silicea. We are having the glonine, etc. Then some persons, because of the stress, they may feel the dizziness, coldness of hands and feet, shortness of breath, like symptoms they are having. Then there are episodic acute stress. So that means this is not the continuous stress, but in between, they get the acute attacks of that stress when there is a mini crisis regularly and that person will live in the state of tension. So people are always feels pressured. Usually it occurs at the workplace, or if in a family, if there is some burden or something like if they are having, they may feel the episodic acute stress when the situation comes the similar way. They take on many responsibilities. They cannot stay organized with so many time demands. When the many types of works or many types of demands are there, or the person has to complete their task within a given time, then that time the person feels this episodic acute stress. There are two main personality types with the episodic acute stress. First, it is the type A and the warrior. Type A personality, that means that person is having excessive competitive drive. He wants to complete it fast within that time, and I should be the first to complete. So these types of persons who reacts with the aggressiveness and wants to do their work very fast. So they are aggressive, they are impatient, they are abrupt. They doesn't want to talk with anybody. They just say, don't disturb me. I just want to complete this work. So there is a time urgency. They react with aggressiveness. Almost has a deep-seated insecurity about their performance, because just they feel if I don't complete my task within a given time, then what will happen? What will be my position? What will be my image? So they want to complete it within that time. Significantly, like these peoples in a later age, they are likely to develop heart disease. The next type, it is the warrior. These are presents with negative thoughts, causing stress on a physical as well as mental health. They believe that the world is dangerous, unrewarding, punitive, something negative is about to happen. The people says this, see, if we don't complete this, these things will happen. I'm going to say, this is sure, this is sure. You will remember what I am saying. These types of words are from that warrior. They are over aroused and tense and more anxious. Even they are depressed than angry and hostile. They always think, what if, what will happen if we don't complete, or if we don't complete our task. So these types of negative outcomes, negative thoughts are there. They are often diagnosed as a psychological syndromes. Next, it is the expression of that is these episodic acute stress. When it is happening, not only for the one time, but when these things happens frequently, repeatedly, these persons becomes angry, irritable, with anxiety, depression. they become short-tempered, they become impatient as well as tense. Then they show the cognitive distress as compromised attention or the concentration. They are processing speed, new learning, and mental fatigue. They want to learn so many things and new things also, but they get easily fatigued. Then their interpersonal relationship get deteriorated, even in their friends, even in their workplace, or even in their family also. Many times they talks with a loud, or they give the abrupt answer, or they becomes irritable. They give the written answers to their parents or their siblings. So their interpersonal relationships get deteriorated. Then these persons shows the muscular distress as intensified than the acute stress. Sometimes they get the stomach and the bowel problems than the acute stress. They may get the high blood pressure, heartbeat, sweaty palms, palpitation, migraine, headache, like these symptoms. But when the immune system compromises, so when these types of stress are there, many a times the person gets, when their immune system compromises, without any reasons, they suffers with the frequent colds or the flu or the allergic like reactions. It may be to the skin, it may be to the mucous membrane. So they shows either the cold and coryza, or they shows the loose motions, or the acidity like, or the vomiting, or in some persons they shows the asthmatic attack without any reason, where we can say there is a non-etiological asthma or the idiopathic asthma and the other illnesses. Sometimes the person get ill without any reason when there is a exams, or when there is a task they have to perform. In that cases, that is the episodic acute stress expression, that person gets such types of complaints. The next, it is the chronic stress. The chronic stress is the most harmful type of stress. If it is left untreated over a long period of time, it is significantly and often irreversibly damage your physical health, as well as it deteriorates your mental health also. So this chronic stress is a long time stress. It is not only the episodic, or it is not the acute stress. There is something remaining in the mind, back of the mind, or the situation is as it is, and that person is not able to find out the solution from that, and it remains as it is. And because of that stress, that continuation of that stress, his physics starts getting affected. It may arise from the serious life problems that may be fundamentally beyond their control. It may be from the traumatic childhood, because their memory is remain there, and the person, when he's alone, it goes on thinking about that, like brooding, or what we say, the brooding, or the he's not able to get rid of that memory. Even when the surface appears okay, even though he appears in a society, public, in a normal behavior, but in their mind, that trauma remains as it is, and it is continuously provoking, which may afterwards gives rise to some physical complaints. Whether the cause lies in your mindset or in the difficult circumstances, it is not only the mind is affected, but situations or the circumstances which that person is not able to change. So in that cases, the many people stop fighting for the change. Initially, they try to change the situation. Then they try to adapt the situation and tries to keep quiet by themselves. Then afterwards, if nothing is changing, they stop fighting for the change and begin to accommodate that chronic stress. They live with that chronic stress, but it remains inside their mind. When an individual lives with that chronic stress, his or her behavioral action and emotional reactions becomes ingrained. Their behavior changes, their emotional reaction changes. They says, I was not like this previously, but now I am becoming such a way, or I am expressing this way. Their friends or their family members, their surrounding people, they also says, like this person was not like that before. Nowadays, don't know why he is behaving like this. So there is a change in the hardwiring of the neurobiology of the brain and the body. He tries to express in a different ways. Next, it is the emotional stress. The emotional stress pain is a rigid than other stress. That means what? That stress remains as it is. That is, the person is unable to change, unable to leave that emotional stress. It comes from the conflicted relationship. or the financial major crisis, or very unpleasant work environment, or a host of other stress can cause emotional stress and brings more physical reaction and stronger sense of distress than the any stress being busy at work. Expressed as a heavy feeling in the chest. The person feels whenever he wants to go or he has to go to his workplace, or he has to go for his college, or he has to go for wherever he is as an employee, wherever. So he feels at the time of going, he by his mind he is not ready to go, but he is pulled to go and to work or to attend that situation. So that time he feels a heavy in his chest, unsettled feeling in the stomach, or dull headache. And next it is the battling burnout. So that is the burnout is the result of a prolonged chronic stress of situations. It leaves people feeling of lack of control in their life. They feel they cannot change the situation. They are not able to fight the situation. They are not able to change anything, neither themselves nor in the surroundings. So they are feeling lack of control in their lives. Certain conditions of the job can create a greater risk of burnout, including a high level of demands. Most of the times nowadays we can say that in cases of IT companies, the people are having high level of demand from their works. They have to complete the task. A lot of work was given, and they are nowhere. They are not able to complete that task. So in that case, they are just becomes a workaholic, and they are just doing the works without involvement in that. So there is an unclear expectation, lack of recognition for the achievements, and high level of risk of negative consequences when the mistakes are made. So alienation from the work-related activities, people may emotionally distance themselves and begin to feel numb about their work. They just do the work mechanically. They are not involving in their work. Even for the students, when the exam is there and if they are not studied, or if even in the school days also, when the what you call uh, when their projects are given and multiple projects at one time, in that cases, or in engineering students, when the multiple projects are given to complete within a very short stipulated time, then they are just mechanically doing. Even the students from any branch, when they are asked to complete the journals, you just remember how you complete your journal practically and say to yourself the reality. You are just writing the journals and completing the task. You are not actually reading or at the end point. Initial journal topics you may have written in a properly writing, studying, and all those things. But once, if you get the journals very late, or if you miss the journal or like things, so that time the people are just begin to feel the numb about their work, and they just mechanically complete their work. At this stage, they start getting the physical symptoms. They get emotionally exhausted. Their performance is reduced, even though the scholar students or the good worker or good employee, they start making the mistakes. Individuals with burnout feel negativity and difficulty in concentration and often lack of creativity. They are just doing the donkey works at that time. So there are easy steps to get the relief of this stress. So till now, I just narrated the different types of stress and how the expression of it is getting. So now how to get relief from that stress? First, identify the actual body side affected. These types of stress, as I said, get expressed in the mentally as well as in the physically also. So now we will see the different type of stress affects the different sides of our body. So how we should get rid of that. So actually, first, any person is there, he just sit quietly, concentrate on his body pain, where it is, or which system is affected, or which part is affected, what type of symptoms that person is having. So first, identify the actual body site affected, then calculate the duration of affection. If it is acute stress, because of that acute stress, it will go within a short period. If it is the episodic acute stress, again with the counseling, just the short counseling, and how the time will heal it. But if it is for the longer period, for that he has to calculate the duration of affection, since how long that person is suffering from that pain or that whatever the complaints he is having. he has to, or you can ask to your patient also, try to recollect whether any incidents has happened over there or what happened. Ask him since when. In a history also we ask since the word. Since, that means since how long you are suffering from such and such complaints. So again in a history we ask what happened at that time. So at that time the person may not be remembering actually, or he is not able to correlate what happened and why he is getting that symptoms. So instead, once you get that information, instruct your body through the mind power by changing the thought pattern. Because till that, as we said, the person is having different types of stress. He is suffering from that stress. He is brooding. Continuously that thought process is continuously going in his mind, even at the back of the mind. Though he is working, looking normal, that things are remaining in his back of the mind, and periodically they are showing the symptoms. So we can guide our mind to give the thought process, or by change the thought process by giving from negativity to the positivity, so the sufferings will reduce. So then detox the mind and get rid of physical or the mental overload. Here we can say just a short pain or the emotional charge. So when we say the stress, we get the headache. When these are just the sufferings, so when the person gets neck complaints, that means there's a lack of forgiveness. He is not able to forgive the person. So if it is remaining in his mind continuously, he get the throat complaints. When that person feels the lack of emotional support, he get the chest complaints. Then if he is having the lot of responsibilities, he get the emotional burden, the financial worries. That time he will get the back, the lower back complaints. So these types of different body sides which gives the symptoms because of such types of emotions or the stress. So now we will see how that is correlated, the correlation of body part affected and our emotions. When any person, when he gets the neck pain, so here I will not say that there may not be any injury or actual sufferings. Here we are going to see the first things. When the person is having, so actually the complaints, it may be injury, it may be stress, or it may be some stretching or like complaints happen. Here now at this session, I'm just going to show you the joint affection. Other systems also affects, and they are having the different reasons for the respiratory, for the GIT, for the female reproductive, for the endocrine. Different reasons are there why these sufferings are started. So even when after taking the medicines relieves, we say we take the history, we take the totality of symptoms, we repertorize, then we choose the constitutional remedy, or we choose the indicated remedy, we say, and we give the properly selected remedy with the appropriate potency, with the appropriate repetition. But still, sometimes we get the symptoms repetition. Again, even though we change the potency, still it is there because we are not removing the maintenance cause. So that is, it may be the emotional affection which is remaining hidden in the person's mind. So we have to change that by giving some counseling or guiding that person to change the thought process. So here we will see the person gets the neck pain. So if you are seeing the person who is saying the neck pain, so it may be because of the heavy pillow, it may be because of the traveling. So that is the acute sufferings. But when regularly the person gets the neck pain, you can ask that person, is there anything is happening which is making you to change and you are not ready to accept and change, which is against your mind? You can ask it in a soft way and in a different language. Otherwise, the person may feel insulted. Whether I am that much stubborn, what you mean to say? Whether I am stubborn? No. You just ask it that whether the things are happening which is against your wish and you are forcing to complete that or forcing to do that. Then he will give you the answers. So usually the reasons for getting the neck pains, there is a stubbornness or inflexibility of a mind, person not wanting to heal or replaced by something. There is inability to make decision, conflict between the thinking of mind and feeling of the heart, whether to say yes or no, these things. And that time the person gets the neck pains, feeling of strong repulsion, afraid to express the feeling or the helplessness. We see even routinely, even we say when there is a person is in a tension, he is not able to express himself, or he feels no how to do, or he feels helpless. That time the person just knows it. So that is the thing where his automatically his neck or his physics shows the expressions. There is an upper back pain. So this is the actual side when the person feels unsupported or unloved, emptiness. In that cases, the person gets the upper back pain when there is a frustration by any reason, by any relation, at any place of his life. That means it may be in a childhood, it may be at his adolescent, it may be at his youth, at college levels, school levels, at workplace, or in a family, anywhere. When the person feels the emptiness, then he starts getting the upper back pain. When there are too much conflicts, or he may carry too many burdens. It may be of study, it may be of work, or it may be of relations. Humiliation or the insult, feeling of not appreciated, that also shows the back pain. Then withholding love or refusing to something to somebody. When we get the shoulder pains, shoulders are, we says, the shoulder. That is one saying, which is the strongest part of your body. It is just the saying that shoulders are the strongest part of your body because it holds your head, and as well as if the person rests his head on your shoulder, you can give the support to that person's head. That means this is his mindset, his thoughts, his tensions, and everything. But it is just the same. So the shoulder, it represents your ability to carry our experiences in our life joyfully. So see, when we are joyfully carry our all the things, responsibilities, till the time our shoulders are okay. Our attitude makes it burden. When we start saying, you see, so many things I have to carry, so many things I have to do, how much workload is given to me, how many subjects I have to study now. So that time, so that attitude makes it a burden. So weight of burden of expectation from outer world shows the stress expressed in that person's shoulder pains. So burden of responsibilities of inner or the emotional world or the family also expressed as the shoulder pain. Undeserved feeling, feeling of not acknowledged. The person gets mid-back pains. So that is just the below of that. So that is when there is a guilt feeling, anger or rage. If the person is having tremendous stress, worry, anxiety, if there is a resentment, fear, especially of losing the control. So you can see that place or that back area actually where it needs a support. Fear of losing of self-control, doubt, wanting to back out of situation or help. So there the person is just standing, just holding everything, and he is knowing what he has done, what he should not do, or what he has committed and not able to complete. That stress expressed by the pain in that person's mid back. Lower back pain. So usually if the person is having lower back pain, you can directly ask whether apart from the actually physically sufferings or the injuries or the physical findings, these are all the emotions which are expressing the physical pains. So if there is any childhood conditioning or the financial fear, so many times we see most of instead of more males, usually the females are having the financial fears, or they are having the lower back pains. But what we say, it may be because of the delivery, it may be because of the anemia, it may be because of the low calcium, it may be because of the menopause. But the basic thing is that most of the females are financially dependent on their husband, usually in a rural area, and these complaints are more marked in the rural area. When they says all the investigations has done, nothing comes, everything is normal, but still we are having the pains. See, these types of pains, but whether very less number of females are suffering, those who are financially on their own feet, financially stable on their own feet. So they are having, but there may be the actual sleep days are like the reasons. But the mental reason or the emotional condition, that is the financial fear, or the feeling of unsupported, fear of social standing, they are having the lack of self-confidence. Those persons are having the backache complaints. There is a fear about the relationship issues. Inner females, where there is conflicts in their house, it may be with the children, it may be with the husband and wife, it may be with the in-laws. So in that relationship issues, the person may get the lower back pain. When there is a fear about the future, feeling of overloaded, and even the persons who are having such complaints, they may show the problems of gut or digestion or the intestine also. When we get the elbow pains, so that means there is inability to accept the change. The person is not easily accept the change. There is a difference. In a neck, I said there is inability to change. That person is not ready to change himself. He is forcing to change, which he is not ready for. And here in an elbow, there is an inability to accept everything is changed, but he is not accepting that the situation is changed in outer world. In that condition, the person gets the elbow pain, not willing for taking new experiences, though he is forcing. That time he get the elbow pains, not willing, not easily accepting for taking new directions for the same work. If someone directs him to do the things like this way, and he is not ready for, after some time, it is not only for the once you said you do no like this, you don't do this the work like this way. So that doesn't give immediately the elbow pains. But if the frequently things happens like that, the person tries to do one thing, and if frequently is abruptly is interrupted and asks him to do the things by other way. So if the frequency is increased in that condition, the person starts getting the elbow pains, the knee pains. When there is a stubborn pride and ego, inability to bend, the person, when there is a stubborn pride, you see the person is not ready to bend. He is a very headstrong. He is very egoistic. He is not able to bend. He is not ready to change. When there is an inflexibility in his decisions and opinions, he is not ready to change the decision or the opinion he has given. When there is a mindset that what is it, I am right. Whatever I am doing, I myself is right. He won't give in. He tries to impose his thoughts or the decisions on the others. So, or there is a fear because of that. If that person innerly feels any fear, those persons are having the knee complaints. Ankle shows the complaints when there is an inflexibility and a guilt, inability to receive the pleasure. Even when the person goes in a party, family functions, marriage, or any get-togethers, in that cases, all or the many peoples are there, but that person, though he is there, he is unable to enjoy. He is not able to laugh freely, not able to talk, or he is not doing any enjoyment. That person's afterwards, this says that there is a pain in my ankle. When it is started, no, they are not able to give the reason, but there is something in their mind that there is some guilt. If it is the right ankle, there is a feeling of lack of support in a career. They are not getting any support throughout his career. It may be from the workplace, maybe from the boss, or maybe from the teachers or the senior teachers in the school or the college life, or it may be from the family. Feeling of lack of support financially. So that is when it is not supported from the family members, from the father or from the mother, the child or the that son may say, okay, I would have done this if my father has supported me financially, or if he has given me that XYZ amount at that time, I would have been reached somewhere else. Such a situations. If it is a left ankle, feeling of lack of emotional support, injuries will cause pain due to some emotional stuff. The toes, so that is again the lack of joy in meetings, experiences in a life, fear of not getting appreciated. Though whatever the work he has done, he is not getting appreciated. Maybe at work or maybe at home. Even the child has won that some trophy, and if he is not appreciated, okay, yes, you have won the trophy, okay, it's good, keep it aside. If it is the only thing or the reaction from the parents, that small boy or that girl feel become a bit nervous. But if these things happens frequently, if she is winning so many trophies or the certificates and the medals, and she or he is not getting appreciated afterwards, in the latter age, that person will develop such a type of toe pains, that is the gout, and then that time that will say, previously I was such a player, or I was such a bright child, but now I was not able to do anything or like participate in such events, as I am having the gout and I am having the pain in my small joints. So he's not able to enjoy even in a get-togethers because he's not appreciated. So that time he is not getting joy in the meetings or in the surroundings. So I will say, we will see some case. So the first, it is the Mrs. of XYZ. Her age is 49, female. She is having the right knee pain since 3 years. She is a housewife. Okay. So she is having the pains. The pains are aching, stitching type of pains in the right knee. Inability to bend that right knee while sitting down. She is not able to sit down. She can sit on a chair, but she is not able to sit on a floor. Difficulty while going to upstairs as pain was. She can go downstairs, but while going to upstairs, the pains are much more. So she needs to take some support. Pains are more in the morning while getting up from the bed. So usually she doesn't sleeps on the floor by keeping some mattress, or like she always sleeps on a bed or the cot, you can say. Then she used to apply tight bandage or massage before sleeping to get relief. She herself does massage with some oil and used to make a tight bandage for that. She is thirsty, takes 1 to 2 glasses of water at a time. Her diet is mixed. She feels constipated. History of acidity with vomiting almost 25 years back. See, for that 25 years back, she had a complaints of acidity. It remained for many years. She took some medicine and now occasionally get if irregular diet. Otherwise, now no complaints of any acidity. Mentally, she is irritable if gets neglected by family members, become easily anxious, fearful, and this feels more since last 3 to 4 years. So these are just her complaints. Basically, she came with the knee complaints or the knee pains since 3 years. So we have taken the rubrics as location, lower limb, joint, right knee, sensation, pain, stitching, pain, aching, stiffness. Modality is aggravated by movement, walking, climbing stairs, bending in the morning, ameliorated by heart pressure, rest, immobility by massage. Thirst, it is a large quantity. Mind, she is irritable, anxious, and fearful. So the remedies came as arnica, Belisper, Bryonia, calcaraflor, Rustox, and Ruta. So as per the totality and seeing her total history, we chosen the remedy as a Bryonia 30 TDS for the 15 days is given. So we will see afterwards what happened after 15 days. So for the follow-up, she comes after 15 days. In that, the pains are 25% relieved. Not much other changes. So again, the Bryonia 30 TDS for 15 days are given. She came after 15 days. There is not much change in pain and movements. Had once acidity and vomiting 8 days back. So, okay. So that acidity and vomiting, it may be because of some irregular food or some change in a diet. So it gives her acidity, which for the 25 years back, she was having such a history of that. And it may come in between if the food or diet is changed. So that time, as there are no much change, so I increased the potency. So I given the Bryonia 200 BD for 15 days. She came after almost 20 days. Though the medicine was given by 15 days, she came after 20 days. So in that time, the pains are relieved much. 70% are relieved. She can sit down for some time with a support, which previously she was not able to. The climbing upstairs becomes less painful. Still needs a tight bandage, massage at night before going to sleep. No constipation in last 15 days. Anxiety is reduced. So I given her a SL, BD, so that is a twice for 15 days. Pains are much better, but when feels anxious, get irritable by anything, pains feels more for the next 3 to 4 days. So these are her complaints. So ask to family members how and when actually the complaint started for. Though she has given the history like that, but when we talk with the family members, what happened actually? Answer was after the marriage of their son 4 years back. Maybe due to excess physical exertion at that time, she may have started the complaints. So these are the same from their family members. So I directly asked the question. So that is the direct question. Whether she was feeling insecure, anxious of losing the position in her home by arriving of new daughter-in-law. By hesitation, the answer was yes. Counseling, guiding, suggestions in the behavior changes of the family members, I given the Briania 1 in 1 dose. After that, she didn't come for any follow-up. She's feeling better. I hope so. But here we can say, so she is major complaints that why even we are choosing the proper remedy, appropriate remedy like the bryonia, even we are giving it initially with the 30, then we are increase the potency, and she is getting the relief in everything. She had the complaints of vomiting 25 years back. So I asked, 25 years back she is having the complaints. So what was the situation of that time? That time also she is having. So that time she was just newly married. Her mother-in-law was very strict and she used to get the fear, pains, stress, whether I was able to perform the task, that is the food and all the arrangement, all the work of the house, whether I will able to make the position, create my position in the house because of that stress, whether I will able to be a good daughter-in-law in that mental stress. She used to get the acidity, vomiting. So these are her complaints. So mental affection, that is by the fear, she used to get such a complaints. But afterwards, slowly after, though she is saying by taking the medicine, she's getting rid of that. But with the help of, as the years has passed, she's had she had some son and one daughter. So afterwards, the stressful condition gets reduced and automatically she gets relief from that her acidity complaints. But now, 4 years back, has their son married, and till the period she was the only queen in their house. So whatever the housework was there, it was done by her. She was a housewife. So whatever the things has to do, the husband used to ask to her only. That son and the daughter used to ask her only. So now the daughter-in-law has come and she is educated. So she started getting the feeling that insecure, whether my position will get replaced by new daughter-in-law. As obviously she is a new bride, so she is getting the attention more from the family members. So this female starts getting the insecure, anxious of the losing the position in her home. So, but she is not able to express these things because it is her imaginary. She is brooding this condition for last 4 years, and though we are choosing the right medicine, she is having the complaints which are not getting completely relief, even though we are giving the Brania 1M. So I said by counseling and guiding, suggesting their family members, not the daughter-in-law, but the family members like husband, I asked that husband to say that yes, you are done so many things for your house. Because of you, we are at this position. You are the twin, and because of you, we all are at such a condition or at such position. I asked the son to give the more importance to, or say ki, yes, because of you, you have managed everything in a house. Now you guide your daughter-in-law so that she will be get trained in your hands. Then she will feel, yes, I am there as my position is not disturbed, and slowly their relation will also develop good, and she will not feel the jealous of the daughter-in-law, and the family will remain happy. So this is the one case. Second case I will show you. The rash with the itching at left ankle since last 5 years. So this is the case of a Mr. ABC, age 64 years, male. He is having the rash with the itching at left ankle. Since 5 years, he is a retired person. So the dry rash started at left ankle 5 years back. Initially, it was a very small size. Now it is an increase. It's with itching, burning sensation, scratching causes more burning, dryness with scales and scratching. Sometimes scanty sticky discharge comes after scratching. Now since last 1 year, a rash is showing the cracks and some oozing. Skin at the side becomes thick, blackish, more itching in the winter, discomfort while movement or bending of ankles, as it is because of the dryness and thickness of the skin. It started becoming painful or discomfort. He applies oil to get relief from the dryness. Also, he feels better after warm water bath. His appetite is good. Thirst is approximately, he takes 3 liters of water in a day. Bowels sometimes feel constipated. In general, there is a dryness of skin all over the body. Mentally, he is irritable, especially with the wife. He becomes restless, want to do some job, for not to remain dependent on son. He is having 2 sons. He doesn't want to remain dependent on their sons, but not getting any job now. So usually the main thing is that here he becomes irritable with his wife only. So the rubrics we have taken, so that is the location, lower limb, skin, left ankle, sensation, dryness, itching, burning, crackling, dry scaly skin, there is a crusting, oozing sticky discharge, thickening of the skin, modalities, aggravated by scratching, aggravated by cold air, dry weather, there is a winter aggravation, then the better by warmth, by moisturizing, as he is applying some oil. Mind is irritable, anxious, and restless. The remedies come as a graphitis, petroleum, soranum, and sulfur. So I given him the graphitis 30 TDS for 15 days. After that, he came for the first follow-up. There is no discharge. Discharge has stopped. Itching and burning sensation reduced by 30%. So I again repeated the graphitis 30 TDS for next 15 days. Then the itching reduced by 50%, cracks are reduced, dryness is as it is. But the person is improving, so I just continually give on the SL. I kept him on a SL for the next 15 days. Again, he came with the dryness is reduced, itching, scratching with the burning feels increased. So I given the increased potency with the graphitis 200 BD for 15 days. Then the itching, scratching, burning is reduced almost 80%. But occasionally feels increasing when mentally he is disturbed. Blackish discoloration is also reduced, skin thickness is reduced, and sleep is improved. So I asked the direct question, as by what he mentally get disturbed, so the itching is increased. After a pause, this time he came alone. So after a pause, he answered, as now he is retired, not earning any money. Both the sons look after his daily needs, but he doesn't have much cash in hand. Whatever he needs, the son brings for them. They gives them. They took them for wherever he wants to go. They take proper care of that person. But his feeling is that he is not having a cash in hand. So he feels dependent on them for that. So he wants to earn some money, own money, as his wife also neglects him, and she doesn't give much attendance towards him. It hurts him a lot, as throughout the life he took care of all the family by doing hard work and earn money. Now he is retired, and wife now says, what's the economic use of you to us? That means if I want anything, how much money you are giving, you earn, you take care of us, that's okay, but now you are retired, so you just keep quiet, you just sit over there and let me do first of the sons and all those family, then I will give you some things or whatever the required. Or if I need anything, whether you are having any money and yes or no, no, then you just remain quiet. We will do afterwards whatever your needs are there, we will complete that afterwards. So that is her saying that what is the economic use of you to us, and that it hurts a lot, and that increases the irritability and insecurity of that person. So by counseling and discussion with his wife, his son, he improved much with graphitis 200 OD for next 15 days, which is followed by SL BD for the 1 month. So you can see that counseling we have seen if there is an ankle, left ankle sufferings, mainly there is a feeling of lack of emotional support. So that emotional support which he needs from his wife, which is lacking, and that is remaining, it is not for the 1 day, 2 day, 3 day. Once he is retired, that means he is suffering from this lacking of emotional support. Approximately the retirement age is either 58 or the 60. So he is having that hidden stress or that hidden thought in back of his mind since last he's carrying it for the almost 4 to 6 years, and that is giving the expression as a physical complaints. So that is the ankle affection. So that is the sensitivity of his body part, where which is the sensitivity of each person is different, and it shows the affection or how the person takes that emotional hurting, at which place that side, that organ, that system affects, and it shows its expressions. Thank you. So this is all about the today's session.
Thank you, ma'am. Thank you so much for enlightening us with the valuable session. Ma'am, there is a question from the participant.
Yes.
Please explain head again. They are asking to explain the head again.
Head.
Yes, ma'am. Yes, ma'am.
Head means what you want to, what that person, neck or?
Respected participant, kindly could you frame the question again? And other participants are also welcome to have the question answer session. Stress related to head, ma'am.
Stress related to head. Okay. So when you get the stress, so there are, I discuss about the various types of stress, either it is acute or episodic or the emotional burnout or the chronic stress. So when there is a stress, so the person gets that different expressions. So you can say that when we get the acute stress, so when there is an acute stress, the person gets the anger, irritability, that is for the temporary period. So the person may feel the muscular distress, tension, headache. So if it is the students are in front of us or other audience, so they can say that they can feel when they are going for the exams or they are giving for some competitive exams or much what you can say, the study load is there. So that time they may feel the stress, tension, headache, or sometimes back, neck pain, like such a things. Or if they have to perform suddenly some they have to give some presentations, even if it is a preparation, they feel there is a gut problem, bowel problem. I said there's such a persons or the personalities, whether the silicea or urgent and nitrogen personalities, when they are asked to go for give the performance in an audience or the lycopodium, they get the suffering like either loose motions, palpitations, or they may get the sweaty palms. So these types of symptoms the person gets. So when there are the head, where the person is asked about the head, so when there is a stress in the head, the person may get the headache, he may get heaviness of the head, he may develop the migraine also. Sorry, he may get the migraine also. In some persons, if it is the severe, that person may get the eye pains. He is not able to see the clearly, as his mind wants to avoid that situation. So in that condition, that person may feel as if he is not able to see. So that is a temporary dimness of vision. That person may get such a symptoms. Actually, when you examine that person's eyes, there is a his eyes are okay as normal, but he is getting the pain and the stress and burning sensation in the eyes also. So in a head also, the person may get the headache. So it is depending upon which type of stress he is having, there the headache it may be there. So you can say the stress, when there is a stress, the person gets the headache. If there is inability to concentrate, inability to recollect whatever he has read, or whatever the work task is given to him, and he is not able to recollect, in that case, there is a headache will be in the frontal region, usually the frontal region. If there is a pressure from the only, even though if he's done his proper work, but it is neglected, not appreciated, and again the next workload is given to him, in that case the person feels the headache at the temporal region. So these are the different type of expression of the persons when he gets the stress. Is it clear? Hello?
Yes, ma'am. There is another question, ma'am.
Yes.
There been a case where there is physical and mental symptom manifestation in a particular location together at once.
To the
Can I repeat the question, ma'am?
yes, please.
Has there been a case where
Huh.
there is physical and mental symptom manifestation in a particular location together at once?
Yes. It is there. That's why I said there is a correlation between the mind and the body. So whatever, but only the thing is that depending upon that person's sensitivity, which type of mental stress or the mental things or the mental hurting that person gets, that get expressed in his physical sufferings, how much he takes, depending upon that his body part suffers and it shows the expressions. Given the examples that female is having the pain in the knees, even though we have chosen the remedy correctly, everything is done, but the basic reason it helps that counseling or that what you can say, the uh, concept behind it is that it helps to act the remedy much more better if you give him or give them the positive thought or change the surrounding by counseling, by suggesting change your thought process. So many things are changed because of you are giving the positive thought. In some cases, not here in a joints, but there are certain respiratory complaints or the female complaints also, that you need to give some positive thought repeatedly to yourself so that it can be changed, that person's mentality and the suffering. Likewise in the PCOD or like, but this is only today I have taken only the joint session about the joints. So that person's, that means we can vice versa, we can say when the person is saying that yes, I am having such and such complaints, you can directly ask, okay, what happened? If you are knowing, like in this diagram when we say that, or you can say in a here also, when the person says, I'm having the backache, back pain, or the we can say the lower back pain, you can directly ask whether there is any financial problem. Nobody will say you directly, no, yes, I'm having a financial problem and so I'm having such a backache. But once you just directly probe, then you can ask whether you are not supported by from your family members or from your office work. Then that person will feel, yes, how come you this person knows? And it may be, yes, these things that burden may be expressing my sufferings I may be having. So there is a correlation between that sufferings and his mental conditions. Anything else?
Yes, ma'am. Please explain elbow pain due to what mental stress?
No pain.
Elbow pain, ma'am.
Elbow
Elbow
pain.
pain.
Elbow pain.
Elbow
Okay.
pain due to what mental stress?
Okay, elbow pain. So that means we say that there is a, if that person, see, he is a normally living, normally is living, his routine is going normally, regularly, and suddenly there is a, we can say, okay, we can give the example in the school days. Okay, the child is going to the school, one subject is by some maths teacher is teaching a very good, that all the students are used to the teaching of that person or the teacher, they are easily understanding whatever she is teaching. And because of some reason, if the teacher leaves the school and some person or that teacher is changed, okay, and now that person who has come, it may be to the any college or it may be to the employee or it may be the boss change or like, but I'm just giving the example for the school going children. And if that person or the teacher is changed and that teacher is a bit strict, that teacher is not taking lightly, or they are not, the children are not ready to accept that person as a teacher because of stress, maybe strictness, or they're giving a lot of homework, or their teaching is not understanding by the students, like it may be. And some students, not every student will get the elbow pain, but some students who are not able to cope up with that change of that person and that person's teaching methodology, after a few days, the child will start saying, this teacher is giving so much lot of homework and I'm not able to write it and I'm getting the by writing, I started getting my elbow pains. Such type of complaints the student says, even the school children. So that means they are inability to accept the change. So if we ask them, okay, how much homework they are giving you, it's a regularly, your teacher is regularly giving you, that is the only thing. Only sometimes it becomes lesser, sometimes plus or minus. It's okay, but now this new teacher has come and she is giving a lot of work. We are writing in a classroom also, we are giving the homework and we are writing at the home also. So they are not willing to take the new experience. They are so stubborn that children's, their mentality, I'm not saying that the behavior stubbornity, their mentality, that they are not ready to accept that teacher and not ready to see how, or the positivity of the teacher, how she teaches, he or she teaches, or how she tries to bring you up more or tries to add a knowledge in your whatever that math or whatever the subject. So they are not easily accepting. It may be situation at the workplace also. Sometimes your boss is changed, or sometimes your work department is changed, where you are expert, you are doing very well, or it may be the person who is doing a very likely work and he is put changed into such a department where there's a lot of work. So that person is not accepting that change at his workplace. So that shows, or he is not ready to take the new experience. In such cases, that person complains about the knee, elbow pain. If you take the x-rays, if you do the physical examination, nothing. He will just say, when you tries to examine that person or tries to move that person by examining his elbow. When you dig out the reasons and the situation by lightly asking, say, okay, so what is the new changes has happened? But before that, you must know if that person's this site is affected. So what could be the mentality or the reason behind this happening? So you can directly ask the questions for that. Anything else?
Yes, ma'am. The question is, please suggest any book which will have the information about mental expression on different parts of body.
It's very difficult because it is collected from so many books. I read so many books because I am having the joint sessions differently, JIT expressions different, then the respiratory expressions different. For the females, we are having the difference. So I collected all this from different books. It is exactly, let's say, one book. It's difficult to say, but I will search and I will give you the idea about it. One book is there is a Chitkara, where it is the mental expressions are given, how the person behaves and how the expressions it gives. But the correlation between that mind psychosomatic. Okay, once I come to know, I will definitely share it with you. Anything else?
I hope the participants have clear. There is one more question, ma'am. Upper part of back pain due to what mental stress?
Upper part of back pain. I've given these things. So when they feel the unsupported. So we see, listen, we say that when we get small things, when you get do some good work or like, even from the childhood to the old age also, if you just pat on his person's back, yes, very good, that the person feels appreciated and supported. Everybody is remembering from the childhood, if our father or the parent just put their hands on our back if we get something, or even if we won, or if we do some good work, and if that time they just put their hand on our back, we feel supported and we feel, yes, relax. And when that person feels that support, if that person doesn't get for his achievement, it may be small, it may be large, if it is unsupported, it is not appreciated, if it is not getting, it may be from the friends, it may be from the family members, or it may be from the boss or at workplace. I said always, it may be at a workplace, it may be from the friends, from the society, from the family members, not necessarily only from the family members. Even if any friend achieves something, or if it is appreciated by the teachers, you just pat on his back. Yes, very good. He feels very good. He's very relaxed. If somebody else appreciated, he loved. When these things are lacking, when the person feels unsupported, it is not only because of we are reading and we are doing the work by bending and our back is remaining bending and we are, because of that extra stress, we are getting that like bending our back like this. We are hard working and we are getting the pains. No, it is not because of that. It is because of the unsupported feeling which is not appreciated, or when there is a conflict that is again the unsupported or the person is not from my side. So that is the conflicts, as well as carrying too many burdens of the workloads or the expectation, insult. So these things are giving the back pain, or refusing to give something to somebody. When person doesn't give, refuse. When the person asks, it may be friendship, it is not the things. But if I ask for the support, I ask frequently for the support, you are knowing so many things and I'm lacking, I'm not knowing. And if I ask you, just please suggest me how to do, please guide me how to do, and nobody is supporting, nobody is guiding me. If these things happens frequently, if he says, sometimes some bosses are there, they say just okay, you just go and read and get it. It is better if you read and collect the things. But if it is not supporting, it is not giving, you see, this is how it is done. So this is the, by this way it is done. And now I told you the half, you collect the half information from others or from you by reading yourself, improving yourself. So these things happens, then this person will get reducing these symptoms without any medicine. So many times there are so many cases are there that they are having the chronic complaints just by giving the strong mental instructions, positive thought process. They get relieved of their complaints, and very less, and they require a very less amount of medications actually required. So is it clear about the upper back pains?
Yes, ma'am. What is the unique homeopathy medicine for spondylitis? This is the question, ma'am.
Pardon?
Ma'am, the question is, what is the unique homeopathy medicine for spondylosis?
No, we are not here now dealing with any homeopathic medicines. We are here dealing with the discussing about the correlation of body parts affected and our emotions, how it is getting expressed. So that will go into the therapeutic part. The Matra Medica and the suffering, that session will carry the specific remedies and all those things.
Ma'am, the last question is, can you please suggest any authors who would have given mental expression affecting different parts of the body in their book so that we can search for it, please?
Given the answer of it, I have collected this information from various books. It is not the one book from where I have just all those things are carried and taken and the PPT is made. I said it is in a various book it is given. That's why I said once if I get the exact name of it, I will share it with you. You can give to the students and you can suggest to the at next session you can give them. But these things are not at one place. These are from the Matra Medica also. These are from the you can say some part of it is from the Farrington also. Some is from the Coulter also. So these are the things we carried from the some various collected from the various different books.
Okay, ma'am.
Okay, I hope everybody has liked or understood some
I
correlation
hope
of the.
everyone has cleared their questions too, ma'am. Thank you so much for the wonderful session, ma'am. I would like to thank today's guest speaker, ma'am, Dr. Neeta Chavan, ma'am, for the wonderful session. And thank you all for the participants for the active participation. And thank you, Team Aisha, for the webinars. And thank you to our media partner, Homeo 360 Degrees. Thank you all. Good night.
Thank you so much.
Thank you. Thank you all.
Yeah.